Welcome to our first surgery broadcast implanting the Oculentis Femtis and Lentis Comfort Toric IOLs using the LENSAR laser system with Streamline. We are coming to you from Valmedic Vision, the international eye clinic in the Principality of Andorra, and from the annual Oculentis users meeting in Andorra. Our surgeons are Dr. Ludger Hannekan of Valmedic Vision in Andorra and Dr. Detlef Holland of the nordBLICK Augenklinik Bellevue in Kiel, Germany. During this surgery program, Dr. Hannekan and Dr. Holland will be implanting the Oculentis Lentis Comfort Toric and the Oculentis Comfort IOL. The Lentis Comfort was introduced in 2012 as the world's first IOL in the new lens category of EDOF, or Extended Depth of Focus IOLs. In contrast to multifocal IOLs, it does not compromise far vision for near, but rather provides a comfortable zone of vision from infinity to 60 centimeters with excellent visual acuity and virtually no photic phenomena. At the ESCRS meeting in Barcelona, Oculentis introduces the all-new Lentis Comfort Toric. The popular Lentis Comfort IOL is now available with astigmatic correction from 1.5 diopter to 5.25 diopter cylinder in steps of 0.75 diopter. The IOL is made of proprietary HydroSmart material which combines biocompatibility and PCO prevention. It has an aspheric optic that is aberration neutral. The lens also has a complete 360-degree sharp edge around the optic to inhibit cell growth. The reported PCO rates of this IOL are extremely low. The technology of the Lentis Comfort is derived from the well-known Lentis M Plus family. Already, 350,000 have been implanted worldwide. Our second surgery introduces the Oculentis Femtis IOL. Oculentis has introduced a revolutionary new IOL that was especially developed for machine-made anterior capsulotomies, as is the case with LACS, or laser-assisted cataract surgery. The IOL has a special haptic design which allows the lens to be clipped in the anterior rhexis. Currently, a major international multi-center study is being carried out under the leadership of the University of Heidelberg in Germany. The goal of this study is to clinically assess the proposed advantages of this design, these being less decentration and tilt and better predictability of ELP. The Femtis IOL has CE approval and is expected to be commercially available in late 2016. The nordBLICK clinic in Kiel, Germany was the first clinic to incorporate the lens in their daily practice. With more than 1 year follow-up, the lens is behaving as expected with excellent visual acuity results and also shows very low rates of PCO due to the 360-degree square edge design and HydroSmart material. The Femtis IOL can be implanted like any other IOL through a sub 2.0 millimeter incision into the capsular bag. Then the anterior haptics are placed in front of the anterior capsulotomy. The learning curve is very short, and the placement of the haptics just takes a few seconds more than implanting a common IOL. At this live surgery, we will be implanting a variant of the Femtis IOL, specifically the Femtis Comfort, which combines the new IOL design for LACS with the very popular EDOF optic of the Lentis Comfort. LENSAR, a leader in next-generation femtosecond laser technology for refractive cataract surgery, has received the CE mark from European Union regulators for a suite of 5 new application technologies integrated into the company's flagship product, the LENSAR laser system. As the first femtosecond laser cataract platform to enable automation of key surgical procedure planning and execution elements, the LENSAR laser system with Streamline application upgrades include wireless integration with Cassini corneal shape analyzer. Other popular topographers are also being evaluated. Astigmatism management, including iris registration, arcuate incision planning, and IntelliAccess steep axis corneal marks. Additionally, automated cataract density imaging, and finally, automated fragmentation patterns.
With the Streamline technology LENSAR recently introduced. First thing is astigmatism management. And the second thing is that we can actually streamline, that we can customize the algorithm, the pattern of the fragmentation to the necessities. Because of the excellent quality of the image the Scheimpflug camera can generate, the system automatically is measuring the type of cataract, divides the cataracts into 4 different stages, and then you can apply according to the pattern for the fragmentation, which is best for you, automatically deform the nucleus. The cataract is pre-fragmented by the Lenser laser, something which is unique to this Lenser system, and no other system can work and offer right now. For example, I could show you the planning steps of a patient which we did today, and we did not implant a toric lens, but we wanted to take advantage of the possibilities to correct in a very easy way that astigmatism, the residual astigmatism of this patient, calculating the induced surgical astigmatism and correcting that with the arcuate incisions. So we can see here that the cylinder is about 0.96 diopters, which is a little bit too less to correct with a toric lens, in my opinion. But with the incision on 120 degrees, which I normally do, we have a residual cylinder of 1.2, which is a little bit too much, which I don't want. So what we can do is very easy. We can plan to correct the residual astigmatism with these systems, and we can see that with 2 arcuate incisions, this residual cylinder astigmatism is lower than 0.1 diopter. And we can see it here. If we change for some reason the incision location from 90 to 126, for example, or if we want to do it from the temporal side, we see that the system automatically compensates for that. Positioning of the arcuate incision is in a little bit different place, and the size and length of the arcuate incision changes a little bit, but it's so easy and makes you so flexible, and you can adapt to any surgical needs.
The surgeries will be beginning shortly. Please be sure to use the text box at the bottom of your screen to submit questions at any time, and the doctors will address your questions at the end of the surgeries.